All the latest around the ongoing pandemic with the coronavirus newscast in an hour. First, Later Than Build, join the debate with Fiona Bruce.
Welcome to Question Time. On tonight's panel, George Eustice, Secretary of State for Environment, Food and Rural Affairs, Labour's newly appointed Shadow Home Secretary, Nick Thomas-Symonds, who joins us down the line from his constituency in South Wales, Afua Hirsch, commentator, broadcaster and author of a book on British identity, British on Race, Identity and Belonging, Jürgen Meyer, industrialist and former Chief Executive of Siemens UK, business advisor and board member of the Northern Powerhouse Partnership. He joins us from Manchester. And Chris Hopson, Chief Executive of NHS Providers, an organisation for all of England's ambulance, community, hospital and mental health trusts. Good evening. Welcome very much to our panellists here and, of course, to Jürgen and Nick, who are joining us down the line. Now, you know the score by now. We have no physical audience here in the studio, but this week's pre-recorded questions come from Newcastle, which is where we were intending to be before all of this happened, and we'll be taking a couple of questions live as well tonight. And as usual, of course, we've been hearing from you at home via social media, and if you want to keep on feeding your questions and your comments in, contact us on social media at BBC Question Time. I'll get them on this tablet here, and I'll feed those in to the panel as we go along. So, let's take our first question tonight, and we are joined by Margaret Collins. Margaret, good evening.
Good evening. I've many questions concerning our government's handling of the coronavirus, but this morning I read, according to statistics from Johns Hopkins University, Sweden has 28 deaths per 100,000 inhabitants. Norway has 4 deaths per 100,000 inhabitants. Denmark has 8.7. Finland has 4.5. Even the USA has less than the UK at 21.7. So they're all lower than the UK, which has a nationwide lockdown, and the toll is significantly higher at 44.4 per 100,000 inhabitants. My question is, why and how did the government let this happen when we had advance warning of the figures coming out of other countries? As a country, we're meant to be celebrating VE Day tomorrow, but who feels like celebrating? I don't feel particularly proud of being British when I see figures like that.
Chris, let's start with you.
Well, the death rate is clearly very concerning, and we can talk about numbers, but behind each individual number there is a personal tragedy for both the individual concerned but also their relatives and families.
But what do you think when you hear Margaret list those numbers like that?
Well, it's very concerning. If you look at the levels of mortality that we have in this country, I do think, though, when I talk to my public health colleagues, what they say to me is just be very careful about making international comparisons at this point, because there are a number of different reasons as to why different countries may have different death rates. For example, there isn't a single universal way of recording coronavirus and non-coronavirus.
I get that, and obviously that's something the government have been very keen to say, but nonetheless, whether we're the worst in Europe, we've got the highest death toll in Europe or the second highest death toll in Europe, maybe even the third, it's not where anyone would want to be. And Margaret's question is, why has this happened? What's your view, given you're at the coalface with the ambulance workers and the hospital workers?
I'm quite rightly, Margaret wants an answer to that question, given the levels of deaths that we've had. I mean, the reality is we are going to have to wait to do the real detailed analysis to find out what has happened here. And I think, as I said, it's dangerous, and that's certainly what our public health expert colleagues say, to draw conclusions at this point. Okay. But clearly, with 30,000 deaths, it is a real issue.
I think there are some conclusions we can draw. I'm not party to the intelligence and information that the government has, but I remember in February, 2 local schools where I live in South London were closed because of a coronavirus outbreak and concerns the infection spreading. By then, other countries were already implementing lockdown measures. And it was weeks before our government started to take this seriously. And I think that Margaret's question, which is a really sad one and an honest one to hear, has kind of 2 components. One, why has the government handled it this way? Why has everything taken so long? Why do we always feel like we're playing catch up on PPE, on lockdown measures? And then the second component is the government's tone. Because for me, to hear our government congratulating itself on the way it's handled this outbreak.
So Boris Johnson called it our apparent success.
It's insulting to the people who continue to die every day. And what I would like to see is some honesty from the government, acknowledging that this was not well handled, that mistakes have been made, and telling us clearly and transparently what they intend to do differently. Because at the moment, the gulf between what we're experiencing, the number of people who are dying, the heartbreaking scenarios of people dying alone, often in unnecessary circumstances because we haven't got a grip on this. And the government's rhetoric is only losing further trust. And I think that trust is important right now. And until the government shows some honesty and integrity, we can't even begin to see how we can move forward.
And Jürgen, I saw you were nodding at that.
Well, yeah, I mean, I think Margaret's question is absolutely spot on. And what you said in your question, Margaret, is that we didn't plan ahead. So we're managing this in the here and now. And that makes managing a crisis like this unbelievably difficult. And I think, you know, we should say a huge thank you to all of the people who are doing that. But what should have happened is we should have spent much more time planning early on. And we saw the signs from Italy, and we knew that we had to put testing capacity in place, and we didn't do that early enough, and we didn't lock down fast enough. You know, there should have been a hard, fast lockdown. And in hindsight, we know that would have been better, but we just didn't plan well enough ahead, I'm afraid.
I mean, it's interesting because in February, the UK was ranked second best place to deal with a pandemic. This was by the Global Health Security Index. Margaret saying, how has the government let it happen where we've got a death toll as we have? Nick?
Well, it clearly isn't a reason for celebration, Fiona. It's an extraordinary tragedy for our country and a tragedy for each and every family. And to see that figure today of over 30,600 deaths was startling and shocking.
So what did you think when the Prime Minister described it as talked about our response to the pandemic as our apparent success?
Well, it's not a success or an apparent success, Fiona. And throughout this crisis, we've quite rightly supported the government in its aim of minimising loss of life. But we've also called out things when we thought the government wasn't acting in quite the way that it should. And there are questions about how well prepared the country was for this particular type of pandemic. But we were also slow into lockdown, slow in terms of a comprehensive testing and tracing strategy. And there have been significant problems between what the government has said is available in terms of personal protective equipment and what's actually got to the front line.
And
now,
you say, Nick, you say that the government was too... Sorry, Nick, cutting across you. You say the government was too slow in introducing the lockdown. Was Labour calling for the lockdown to be introduced earlier?
Yes, absolutely, Fiona. And I was there, actually, in the House of Commons on the 23rd of March, and we actually called for the lockdown in the House of Commons prior to it being announced later that day. And I think that was something we raised on the floor of the House that day.
But what about earlier than that? Because that was obviously just a few hours earlier. If you're saying the government was too late in introducing a lockdown, I presume you don't mean by a few hours. I don't really recall that, but maybe I missed it, Labour calling for a lockdown in February, say, for example.
No, listen, what we tried to do throughout this crisis is to be supportive, Fiona. You asked me about when we called for a lockdown. I was sat in the House of Commons on the day that we did. But the point that I'm making really is that, of course, we will come to a point in the future when we must look very robustly with great scrutiny as to what the government did and what differently it could have done throughout this crisis. We have to answer that question as to why we've ended up with this tragic death toll as we have. But at the same time, we can't simply say this is something for the future. I hope the government is learning lessons as it is going along on the issues of testing and tracing, on the issues of personal protective equipment, to try to minimise loss of life going forward.
George? Apparent success? Is that how you describe it?
Well, look, what the Prime Minister was describing there is what we've all done as a country. People who've stayed at home, observed social distancing, our fabulous NHS, and everybody else who's responded to this crisis.
That's that is all to save lives, and we now have this.
Yes, but I think, look, we are in an extraordinary
now.
time, and it is right to acknowledge the steps that everyone has taken, and that's all the Prime Minister was doing. Look, I think the point I'd say here is it's very difficult to make these international comparisons because different countries are recording deaths in different ways.
Different countries have different circumstances. London is a huge city with a big public transport system. That could have had an impact early on. There will be a time and a place to reflect and learn lessons from this at the end of this. But for now, we are dealing with this epidemic.
What's interesting about that is I've watched every one of, as you would expect in this job, every one of the press conferences at 5 o'clock since this started. And at the beginning, in the first month or so, when you were showing those international comparisons, there was no reference to the fact that those comparisons might be a bit dodgy when we were below the other European countries. Now that we're above them, the government's very keen to point out that actually we shouldn't be making those comparisons, but you never said that earlier
we weren't making comparisons. We've always tracked the death rates that have been reported in all countries.
But you didn't warn us off them,
well,
as you are very much trying to do now.
We followed the advice of the Chief Medical Officer and our Chief Scientific Advisor. And the belief all along, which I think was correct, is that we were roughly 2 to 3 weeks behind countries like Italy and France. We were on a different trajectory. That's why it wasn't appropriate to lock down at the point that they did. But it's not true that we weren't prepared. There were all sorts of COBRA meetings and planning meetings that were taking place on this right from January onwards. And it was occupying all of Matt Hancock's time. So lots and lots of planning and preparation went into responding to this. But it was the case that the scientific advice was not that we should have locked down earlier than we did. And as soon as the advice was that we should lock down, it's exactly what we did.
So you think you... sorry,
this is what I mean by honesty. The government has been changing its narrative to fit its results. So initially we liked international comparisons because they made us look good. Now they make us look bad, we can't trust them. The advice on PPE was to use the PPE recommended by the World Health Organization. Until it emerged we didn't have it, and then the PPE advice was changed to fit what we have. The definition of testing was changed when it emerged we couldn't meet the 100,000 tests a day standard we promised until we suddenly could by changing what counts as a test having been sent out rather than a result having been received. And for those of us who aren't medical experts, who are just members of the public watching people we know and love die, there is an unavoidable feeling that the government is not being honest with us about the scale of this crisis. Yes, we've all done everything we can to try and mitigate this, and we are all trying to come together and help. That doesn't make this a success. This makes us people who are suffering and doing our absolute best in circumstances where we can't help but feel that the leadership has failed us. And I think we deserve an honest acknowledgement of that.
Well, it's simply not true that there's been dishonesty or anything in this. From the very beginning, we've been holding daily press conferences. The Chief Medical Officer has been attending many of those. And they've been very, very candid about the nature of this crisis, the reasons we're doing the things that we're doing, very candid about the evidence and the epidemiology behind this. So we've been, I think, as frank as possible with the public, and we've shared with them all of our thinking at every stage.
I think the bit that does need to be recognised here is if you wind back to 10, 12 weeks, and we were looking at what had happened in northern Italy, where their health system had been completely overwhelmed, and we had the awful prospect of people turning up to hospitals and simply not being able to be treated. And I think the bit that we do need to recognise is that the NHS has actually created 33,000 beds to treat coronavirus patients. We've created 7 Nightingale hospitals, literally within the space of a fortnight.
It's not worked quite so well with the care sector, though, has it?
No, absolutely. We recognise, I think everybody in the health and care system would recognise it's not worked so well with care homes. But all I'm saying is, if you look at that prospect, the NHS was really clearly told you have to do everything to avoid that overwhelm. And I think the bit that we do need to recognise, because it's due to the hard effort of 1 million frontline staff, is that we have managed to avoid that overwhelm. And as I said, it's very difficult in the sense to kind of talk about celebration when we're talking about this in the context of Margaret's question of 30,000 deaths. But we should recognise that.
But why do you think... I mean, George is saying we did everything at the right time. Lockdown was done at the right time. Why do you think, then, if that is true, not according to you, Afua, why do you think we have so many deaths, then?
Well, I think it's really difficult to tell at this point, Fiona. And as I said, I know that people quite rightly want the answers, but there are potentially lots of reasons. If you look at population density is clearly one. I think you raised quite correctly the fact that our social care sector has been completely neglected. And we know that what happens in a crisis is that the crisis inevitably finds the weakest link in terms of the area that's been underinvested in, that hasn't been sorted out. So there are some reasons, I'm sure. But all I'm saying is we need to be careful about jumping to immediate conclusions on the basis of, to be frank, incomplete evidence at this point.
Nick,
although I think...
sorry, Jürgen, yes.
Fiona, I mean, all this discussion about comparisons and we're not sure. I mean, I think the data is good enough for us to say that a country like ours, like Britain, with all of its capability, we should have done better. We should be doing better. There's no doubt about that in my mind. And I think in terms of the planning, I'd like to come back to this point of testing. We didn't plan ahead well enough. If we would have done, we would have had the tests of the 100,000 in place by the beginning of April, not started building it at the beginning of April. So I think there were some key lessons, and I do think we've got a long way to go. We need to live and manage this situation, and I do agree with Afwa's point that a bit of honesty, a bit of learning, so that we can learn as we go into the next phase and really make sure that we make a better job as we now try and exit out of this terrible situation.
And Nick, you had your hand up. You want to come in. I mean, George is saying that government has been candid throughout. Do you feel that?
Well, the government has been inconsistent, not least around the issue of testing and tracing. The lockdown was absolutely essential, but it was a blunt instrument unless you had a testing and tracing strategy. Now, the government was actually doing community testing, but it stopped doing that on the 12th of March. Originally, it was said that was a policy decision, but more lately, it seems it's been admitted that was because of a lack of capacity. Now, it took weeks and weeks after that for the government to then start to actually ramp up testing to the level that it needed to be at. But it's not got to that yet, and I'm afraid that hitting the target on the 30th of April, it seems that that was done by putting a number of tests in the post without an actual guarantee that those tests had been used. And we've seen the test numbers, again, falling below 100,000 in recent days. Now, that needs to be ramped up again very significantly, and it needs to be attached to a proper tracing strategy. And that really has to be a focus now for the government in the weeks ahead. Let
me come back to Margaret. So, Margaret, you sat here very patiently and listened to that, and thank you for that. You said figures like the ones you quoted don't make you feel proud to be British. What do you feel about the responses you've heard?
Oh, just disappointed. They haven't really answered anything. And I agree with some of the points. We've got to wait and see. However...
So what would your question... We've got George Eustice here from the government. What would your question be directly to him?
Why didn't they have testing, PPE earlier? The government must have known about it.
Well, we have ramped up testing considerably. So
that's not the question. The question is, why didn't you have it earlier?
Well, there are some countries that had more diagnostic labs. So countries like Germany had a lot of those diagnostic labs. We had to expand them from scratch. And the Army have been involved in this and done a fantastic job. We've now got 90 mobile testing units around the country, 50 drive-through.
But could you have ramped it up earlier? I mean, there's been an enormous effort.
Up as quickly as they could. And we're now at that 100,000 capacity, and it's going to double again over the next month. We will be ramping it up further.
Margaret, does that satisfy you?
No.
No.
I should say as well...
I'm full of praise for the NHS. I'm not criticising the NHS. I think they've done a wonderful job. I'm criticising the government's lack of preparedness.
OK. Well, Margaret, listen, thank you very much for your contribution this evening. Let's take another question now. Let's talk to James Clancy.
Good evening. One of the major issues that will concern many viewers who will download the mobile app is our reluctance for the government to access our private data and all the privacy issues of using such data. For track, trace and quarantine to be a success, it is essential that the authorities have access to our personal data. Then they can track if we have caught the virus, to pinpoint where we have been and whom we've had contact with. When measured against what we have already lost, our freedom to socialise, our future economic and job prospects, not to mention the potential danger to our health, does the panel feel it is a small price to pay to share parts of our personal data to control and quell this virus until a vaccine can be found?
And James, what do you think? Do you think it is a price worth paying?
I do think it's a price worth paying, but I also as well think we should be doing more. We've got to help these tracers to get at least a 70 to 90% success rate if track and tracing is going to be successful.
Okay, so George.
So I think it's that's why I phrased the question the way I did, because I think it is a price well worth paying.
So George, the app has launched, it's been trialled in the Isle of Wight as of today. You obviously do think it's a price worth paying, clearly, because that's why you've launched it. Can you just explain to us the detail of how it's going to work? So say, for example, the app that James is referring to, the tracing app, I get a ping on my phone saying that I've been in contact with someone who has reported symptoms of coronavirus. What happens then?
So it's being piloted, as you said, in the Isle of Wight. The idea is, and people will go onto the app, they will enter their phone number and their postcode, and no other personal details, by the way. And if their mobile phone is in contact for a certain length of time, and that's being trialled and piloted now with other mobile phones in that area, and that person subsequently shows symptoms and reports those symptoms, then those other people who have been in close or regular contact with that person will receive a notification to say that someone who they were in close contact with has reported symptoms.
And what should they then do?
And they should then self-isolate as well.
What, for a fortnight?
For that's to be decided, but I think 2 weeks is one of the things that's being suggested. And this could be very powerful once you get to.
But hang on, let's understand how. Wait a minute. Let's understand how it works, though, just to be clear, because this is something that may be coming the way of all of us. So you get an alert on your phone saying you've been in touch with someone who's reported symptoms of coronavirus. Self-isolate for a fortnight, and then what? Your family has to self-isolate for a fortnight as well?
These are details that are being worked through, but essentially...
But we don't know yet.
But we don't know yet, no, and this is why we're piloting it in the Isle of Wight. This could be very powerful, though, once you get to the point as life starts to begin.
But this bit must have been worked out, because the people of Isle of Wight are actually doing it. They must know what they should do when they... So
they should isolate, yes.
And members of their family?
I think they should isolate as well, as is the case if anybody has got symptoms. But if they don't show symptoms, then obviously it's a different matter. But this is quite powerful because it means with the system
hang on. So they should self-isolate if they have symptoms, but not if they don't have symptoms?
No, they should self-isolate initially, but if they don't have symptoms, then obviously they wouldn't need to isolate for longer than that. It's a period...
Should they get tested? Are they going to get tested?
These are things, though, that we are working through. So, yes, testing in conjunction with this could be an option. But these are details that are being worked out. That's why we're piloting it, to work out precisely how that would work. This could be very powerful, though, because it'll show us where you get flare-ups in particular parts of the country, because lots of people will be reporting symptoms. So we'll be able to track and monitor the progress of the virus and our success in getting it down. But also, if there are hotspots that flare up and an action is needed, we will have that knowledge. The crucial thing, though, is it's not going to sort of be storing and recording people's locations that can be identified to an individual. This is a system that keeps all of that data anonymous. It operates, as a system that keeps people's identity clear of any involvement.
And I know it only launched this morning. Do you know what the take-up has been on the Isle of Wight?
No, I don't have that data yet. It's only just been...
It's 20% so far.
Oh, right, Chris knows. Well, that's something.
Yes.
It's 20% so far.
It's 20% so far. So if the app is going to work, then I think there are 2 or 3 things that need to happen. First, it clearly does need to work in terms of, for example, there are some questions about how much battery power it pulls off an iPhone. The second issue is that it clearly needs to be linked to the right track and tracing resource. In other words, if, for example, you have been in close contact with somebody, you will want to get a test very, very quickly. And one of the issues is that by focusing, as we have done, on purely hitting that 100,000, as the government has done, to hitting that 100,000 target by April the 30th, we haven't really quite got the geographic spread that we need of testing. So that will need to be ramped up. So
because you've talked about staff members having to wait, what, 5 days?
Well, so I think, we should recognise the fact that the testing capacity has grown really quite quickly. But the problem is, if you just focus on the number of tests on April the 30th, you're missing a whole bunch of things.
Well, it is the only day we've had that number. I mean, the testing hotline is warning that test results could take 7 to 10 days. Well, so I'm just thinking, if you have to go into self-isolation...
that's a real concern for some of our...
2 weeks, and then you can't get your results for 7 to 10 days.
It's a real concern for some of our Trust leaders. So I was talking to a Trust Chief Executive yesterday, who 2 weeks ago was able to get tests tests turned around within a day, but they're now taking 5 days. So what we're basically saying is, yes, OK, the capacity is part of the story in terms of growing the capacity, but what we've got to ensure is that everybody who needs access to a test can get it quickly. And then the other thing that we need to be...
And are you confident that will happen?
Well, that's a bit that still kind of needs... I mean, the NHS needs to play its part, but we also need support from the government. The other bit, which is the bit that we're specifically talking about, is as we exit and begin to ease lockdown, it will be really important for everybody in the NHS to know that the role that they're meant to be playing in terms of the use of this app and supporting it. And this is coming really quite quickly, but at the moment, nobody in the NHS quite knows what role they're meant to be playing to support the app. So what we'll need is the results of that pilot, that trial in the Isle of Wight circulated very quickly, and all the trusts, GPs, 111 service pharmacists that are absolutely at the front line of talking to patients, they'll need to know very quickly what they're meant to be doing in a way that they don't at the moment.
Lots of people need to know how it works, and as George doesn't appear to be completely clear about how it's going to work.
I can't help but feel that the government keeps getting distracted by the wrong things. I mean, we were talking about why the government didn't have testing in place earlier. I think one of the reasons is that they were too consumed all these models and ideas about herd immunity instead of actually, which now seems like a devastating idea, instead of doing the work of getting testing, protective equipment, contact tracing in place. Now here's this app, which, forgive me if I don't feel like the government actually fully understands how it's going to work.
But we're certainly not entirely clear.
And that point is crucial.
It's being piloted. We do know how it's going to work, and that's why it's being piloted in the Isle of Wight.
We've heard about the NHS. Care home staff who are on the front line, who are experiencing a catastrophic situation, still can't get tests. They're having to apply for them online. They're not getting them in time. Many care home staff are saying every day they can't get their hands on tests. How can whole sections of the population who are using this app, which the government is encouraging people in the Isle of Wight to use, without any clear idea of whether they'll be able to follow up with testing? And even though you said that George, that there won't be masses of data on the database, my understanding is that once you sign up to the app, no, there isn't a lot of data. But as soon as you develop symptoms of coronavirus, you have to have that information stored on a database. Otherwise, it can't work.
Well, James is asking, is that a price worth paying?
Well, I don't know, because I don't have confidence that the information and data protection professionals have been consulted in this process. I mean, certainly I've seen data protection lawyers saying that the Information Commissioner was not consulted on the development of this app, that it potentially fails the NHS app standards for data protection. So there are so many questions about who was involved in this process, who was consulted, what assurances can the government give us in the data protection standards. And the NHS doesn't itself have a perfect track record of storing patient data. So I think we're very right to be concerned. It may be that it is a price worth paying, but we need to be assured that a very rigorous process has been undergone before we get to the stage of being able to have an informed conversation about that. And I think we have to, when we're giving away our civil liberties, all of our liberties, including privacy, we have to be informed about what we're giving away and what we're getting in return. And I haven't seen anything like that quality of conversation happen yet.
Jürgen, I could see you wanted to come in.
Yeah, I mean, first of all, we absolutely need this technology. We need this app, and we need to be able to track and trace. This has been the strategy in countries that have managed this very successfully, in South Korea, for example. And I think specifically to the point of data, this needs absolute trust and transparency. I think everybody needs to understand exactly what the data is going to be used for, which is only for this purpose of tracking and tracing, and with that, making sure that we can save lives. That's what it's about. An absolute trust that this data will not be used for any other commercial purpose. And one final point I'd just like to make, what I am a bit surprised about is that we're not learning from countries that are further ahead of this. They've already resolved some of these problems. They've resolved some of the privacy issues. And we do seem to be going down a bit of a go-it-alone strategy here. And I would suggest that, let's do our trials in the Isle of Wight, but there might be a good idea to back another horse, which is the app that's being developed for Korea, the one that's been developed in Europe by Google and Apple, so that we've got two horses, so that we can get one of them to work very quickly, because we need to.
Nick, do you think we should be doing that?
Fiona, we are in favour of using test, track, and trace, and we've been arguing for a strategy on this for some considerable time now. So I think the app is very much a part of that, and I think it's an essential tool as we look at that tracing strategy now going forward. It is also true to say, though, that it is going to require oversight. Clearly, there is going to be a set of data. It's going to have to be held centrally if you're going to pick up those different parts of the country where there are outbreaks. And I think we need to be clear that that is being protected. And as has been already said, that the data is used exclusively for the purpose that it's meant for, which is this public health emergency, and not for enforcement or surveillance or for commercial purposes. So I do think there needs to be a parliamentary oversight, but I think the app itself is going to be a necessity going forward in order to move out of the lockdown.
So, Fiona, I think we're missing something quite important here, which is actually, Jürgen talked about the two different apps. We do need to understand that the two different apps have actually got different ways in which the data is held. So the Google Apple app actually deliberately has a decentralised approach and doesn't hold all of the data in a single database, whereas the one that the government is developing at the moment does. And I do think there's a really interesting intervention came about 3 or 4 weeks ago from the Director General of MI5, the former Director General of MI5, Jonathan Evans, who said that he thought it was incredibly important that we had the quality of national debate that Afa was talking about in terms of around these issues. And interestingly, he pointed to exactly the same that Nick was talking about, which is there are circumstances in which you do use personal data, for example, fighting crime and preventing terrorism, but there are some really strict oversight, parliamentary oversight procedures to ensure that that data is being held properly. The app will only work if we can get 50 to 60%, 70% of the people to use it. I think people need to be confident that they can trust it, and therefore what's really important is that that oversight should be put in place and people will know that the data they are going to provide is not going to be misused.
Yes, there is.
I think that one of the advantages of the NHS app that we've been developing, I think people can trust it, it's part of the NHS, but it also, unlike some of those others, gives you better information about where you might get local flare-ups, so that we're able to respond to that and monitor local or regional pickup in the virus.
I mean, there's we've had a number of comments in. There's one here. The government's new tracking app, is it really safe using Bluetooth? Just an idea of the kind of concerns. Can criminals take personal info from your phone? Plus, will it only work with honesty from the user? You know, obviously, because you have to report that you have symptoms. Is it really going to be any use? And as you say, you need a pretty significant take-up to get the information you want from it. James, what do you think of what you've heard so far?
Jürgen mentioned South Korea. Now, the reading and research I've been doing about South Korea is they not only use a track and trace, but also as well they use some other data that is freely available. They use information from the GPS system, they use CTV system, and also as well from credit card spending and spending like that. And as I said during the conversation, we need to give the tracers as much information as possible. And just look at the sacrifice we've all made, that we need really to trust the tracers to be able to meet that target to quell this virus of 70 to 90% of the people that if I was infected, have been in contact with the last 2 weeks. If we don't do that, we could have another flare-up. So I think the privacy issue has got to go out the window, and we've got to see this as what it is. And we've got to use all the available technology and data to make sure that we can crack this virus and let's start living again. Because we've all made too many sacrifices and we're trying to get out of lockdown to save the economy and jobs.
And certainly, James, it sounds like you're desperate to get out of the house, and I have to say you won't be alone in that. You talk about the tracers. I mean, George, the government has said it wants to recruit 18,000 for contact tracing. How many have been recruited so far?
My understanding is it's around 5,000 so far. So that's being built. And look, this is as we try and evolve the policy and move out of lockdown and try to get back to life as normal, a track and trace system along these lines is going to be a critical tool.
OK, let's take another question now from Saskia Jennings.
Do you think it's appropriate to ease the lockdown in all areas of the country at the same way and at the same time, even though the effects of the virus have not been evenly distributed? For example, up here in the northeast, we've seen really high death rates in towns like Middlesbrough and Sunderland, and I don't know if these should be managed in the same way as other areas of the country, for example, the southwest.
And of course, we heard Nicola Sturgeon today talking about Scotland, saying she's not seeing any easing of the lockdown anytime soon, and that's her view. Nick, what do you think about this in terms of easing? I mean, what's Labour's view about easing the lockdown differently in different areas depending on what the rate of infection is, the number of cases, and so on?
Well, I sit here in Wales, Fiona, and obviously there have been moments in the crisis where Wales has taken slightly different decisions. The guidelines, for example, are slightly different. But on the whole, the Welsh Government has tried to take a four nations approach. I think that's been the sensible way to proceed because we do all share these islands. For example, in my own constituency here in Torfaen, I would, in ordinary circumstances, have people who commuted to work. Obviously, different situation at the moment, but in ordinary circumstances, they would commute over the border into Bristol. So it gets very difficult if you have things that are very, very different in different parts of the country. The only point I would, however, make in relation to that, though, is that we just talked about the contact tracing app. Clearly, if there were to be, after these lockdown restrictions start to ease, a particular area where the tracing app showed that there was a very specific problem, then clearly you might have to look at that specific area. So whilst I do accept there will be variations, there have already been variations across the UK, I think we should try to go for the four nations approach that the Welsh Government has been doing as much as we possibly can. However, we should also ensure that as the Prime Minister moves forward, he's said to be setting out a roadmap and some milestones Sunday, that he does work with the devolved institutions in order to get that consensus across the country, because I think that is so, so important.
Chris, can you see from the perspective of the NHS workers that you're representing, is there an argument, do you think, for... I mean, the government has talked sort of notionally, obviously it's too soon at the moment, as the Prime Minister's made clear, about you might have to reintroduce the lockdown in certain areas depending on what's happening. Correct me if I'm wrong, George, about that. But can you see an argument, as Saskia says, for easing the lockdown differently as we go along in different areas?
Well, there's a real dilemma here, isn't there? Because one of the things that's incredibly striking, talking to our Trust chief executives, is the degree to which this has varied very much. If you talk to Trust chief executives in London, it's been really, really difficult. If you talk to Trust chief executives in the South West, where George's constituency is, actually they've been saying that, relatively speaking, it's been relatively, they haven't experienced the level of demand they were expecting. However, there is the bit that we're missing, which I think feels really important to me, is one of the things about lockdown has been the consistency of the national communications. We need to be really, really clear about what it is that we are meant to be doing and not doing.
What do you think it's been inconsistent?
No. My argument would be that if we try and have different areas doing different things at different times, it's already complicated enough as far as I'm concerned in terms of, what are you meant to be doing and not meant to be doing. That it seems to me is a very strong argument to just be careful about splitting the country into different places that are trying to do different things at different points.
Scotland, Wales and Northern Ireland can do it differently.
Yes, clearly the devolved administrations is kind of is a different, in a sense, a slightly different issue. But all I'm saying is that you have this tension because if you were just doing it solely on the basis of where you've got prevalence of coronavirus, what the first peak has taught us very, very clearly is that actually you are getting very differential rates of virus spread in different areas.
Afa, the one thing that strikes me about Sassie's question, not directly what she's asked, but she's talking about easing the restrictions. And given the figures today about the death rate amongst Black, Asian, minority ethnics being twice that, once you take into account numerous factors, twice that of white people. I mean, does that, in terms of their risk, does that in any sense affect either protective measures or lockdown, do you think?
Well, we've got these regional disparities, but we've got this absolutely remarkable disparity in ethnicity. And as you said, today figures show that if you're a black man in this country, you are 4 times more likely to die.
If you just take age into account.
If you just take, and then if you now account for other socioeconomic factors like self-reported health conditions, housing conditions, poverty, they're still twice as likely to die. This has not been explained, and some of us have been, from the very beginning, from the first anecdotal evidence of this, asking for a concerted effort to understand why certain ethnic groups appear to be so much more at risk.
There is an inquiry going on.
There is an inquiry. There are 2 inquiries that have been announced. There is more and more data emerging. I have to say that I have some major issues with the government inquiry and its failure to gain trust among the communities most affected so far. But my issue is this, really. If we are to start easing restrictions, what measures will be taken when people return to work to protect them? I've heard that the NHS has told employers within the NHS to take necessary measures to protect ethnic minority staff in light of the data we have so far, but there's been no consistent message about what employers should do, knowing that their ethnic minority staff are so much more likely to die, to remove them from frontline duties, to put extra precautionary measures in place. Not doing that is an act of neglect that will lead to more people from these communities dying. And that actually applies to the workforce in general. I'm not confident at the moment that there has been clear messaging from the government about what employers should do to keep their workers safe if we start returning to work. There are non-binding guidelines, there are ideas going around, but there is nothing to say this categorically must happen to protect workers when they start.
I think we may get to that a little bit further down in the programme. George, you've got two things going on here now in terms of Saskia's questions about is it appropriate to ease the lockdown differently in different areas, and what Afa was saying in terms of protecting ethnic minorities in terms of their at risk and also the lockdown.
Yeah, I think on the first point, as Chris said, it's preferable if we can try and have a single approach, because otherwise it does get confusing. And some of the advice from the Chief Medical Officer is that actually, although the prevalence can be quite different in different parts of the country, the so-called R rate, that's the reproductive rate, is actually quite similar across the country. So the argument for having very different approaches probably isn't very strong. There are, though, of course, parts of the country that have a lot of tourism, and so there are issues about how we exit lockdown, which sectors of the economy you try to tentatively open and at which stage. And these are factors, obviously, that would be taken into to account in that context.
So might the lockdown be slightly easier or lifted slightly more in places like Cornwall and Devon, say, for example?
Well, look,
is that what you're
obviously
suggesting?
the Prime Minister is going to give his statement on Sunday. The key thing is...
but is that what you're expecting?
Well, for now, obviously, everybody's got to observe the current restrictions. But I think the Prime Minister's already signalled that what he's likely to outline on Sunday is if you like, a route map about how we can evolve this policy. We're going to be very, very cautious, because clearly we're not out of the woods on this by any means.
But I think we're expecting a bit more than a route map, aren't we? Because he said in Parliament this week, the reason we're making the announcement on Sunday, it's Sunday at 7 o'clock, I think, is so we can get going with some of the measures on Monday. So from what he said, something's actually going to happen on Monday.
Well, some things may happen, but look, we're going to be very, very cautious about what happens and under what timetable. This isn't going to be a single announcement that that's the end of the lockdown and everything's back to normal.
Sure, no, I don't think anyone's expecting that.
We're in this for the long haul. We're sadly going to have to live with this virus for some time, and that means that we are going to have a gradual approach to loosening some of these restrictions.
Jürgen? Saskia's asking about a different way of doing easing the restrictions depending on where you live.
Yeah. Well, I'm very much with Nick on this. That we went in it together. The messaging wasn't quite clear enough, and I think as we come out, we have to be together to help simplify the messaging. Now, that doesn't mean that we can't then have different interventions in different parts of the country. So the rules are the same for everybody. But if in Newcastle, which was the example that was used, you do have a flare-up, then that is where you move more testing capacity. That is where you move more of the track and tracers. And I think also, in terms of what Afua was saying, what we need to do is we also need to say there is evidence that clearly black men are unfortunately more vulnerable in this situation. So we need to be much more supportive to black men and make testing available to black men and make sure we've got those early interventions, certainly until we get to the point where we've got more science to understand why this is really happening.
I mean, I would just like to add as well, I mean, black men have the most serious disparity, but many ethnic groups, people of Pakistani heritage, Afro-Caribbean heritage, black women, Asian women are all more likely to die from COVID. So it's actually quite a wide number of different ethnic minority communities whose lives are at stake here. So it really couldn't be more serious. And my issue is I do feel that there was a real lack of intellectual curiosity from the government about why this was happening. It took a very concerted, consistent effort from campaigners, from journalists like me, calling upon the government to take this seriously. And it was weeks before we had any interest, let alone the announcement of an inquiry. And I feel that lives could have been saved if this were taken if this were taken seriously at an earlier stage?
That's not true. This is a new virus, and obviously we're learning new things about it all the time. Matt Hancock has now set up this review to look at all these issues.
Too late.
And it's not just BME communities where there seems to be a higher incidence of the virus and more deaths from the virus. Obesity, there are big links with obesity to death from the virus. Men are more likely than women to die from the virus. So there are many other factors that also need to be looked at.
Let's take another question now from Charles Dobson.
I'm apprehensive about return to work where hot disking is prevalent and colleagues less than 2 metres away. Please can you outline what precautions the government are proposing to ensure safety at work?
There's a little bit of dropout there. Let me just reread Charles's question. I'm apprehensive, he says, about returning to work where hot desking is prevalent and colleagues less than 2 metres away. Please can you outline what precautions the government are proposing to ensure safety at work? Now, obviously, you started mentioning this, Afua. We'll come back to you on that. Jürgen, I mean, I know you're not running Siemens anymore, but you're certainly involved in lots of other companies. What's your view about how this should go ahead? For people like Charles, he won't be the only one who's anxious about how he can feel safe at work.
Absolutely, and it's such a perfect question because there are millions of people feeling in exactly the same way, and what certainly we need in the statement on Sunday and then the plans that we get thereafter is really, really good guidance on how safety in the workplace is going to be ensured. And there are obvious things that can be done, and indeed a lot of the economy is working today. The retail sector is working, transport sectors are working, so we learn from those and we make sure that we're putting the absolute right measures in place. You mentioned the example of hot desking. I think one of the rules in offices will be that hot desking is not allowed. Because that is obviously the sharing of equipment, or certainly, there'd have to be a lot of sanitising in between. But these guidelines are going to have to be crystal clear so that we get a huge amount of confidence. And there also needs to be some policing of that. And we have the ways to do it. Every company knows how to do risk assessments to keep people safe at work. And I think the same rules apply here, and we have a health and safety executive that can help enforce that and make sure that they're working together with businesses and that we're creating the right safe working environment.
And Nick, do you think the guidelines, do you think that the provisions that are put in place for employees should be legally binding?
Well, I don't think that the draft guidelines that have been suggested so far are sufficiently precise, and I think you absolutely have to have a method of enforcement. But we've been arguing for a national safety standard and putting that together with employers, with the TUC, and of course across political parties, so that everybody can have confidence, whether it's employers, employees, everybody in the workplace can be sure going back to work. And I think there needs to be, yes, a recognition that workplaces are different, but we need to be risk assessing our workplaces. We need to be looking at what's required in terms of distancing, whether it's screens, supplying the appropriate personal protective equipment. And then alongside that, we absolutely need an enforcement mechanism. And quite rightly, Jürgen drew attention to the health and safety executive. There are local authorities as well, of course. But what we really need to make sure is that there is sufficient resource available for that enforcement to take place. And if that is the case, then we can have confidence going forward that people do feel safe going to work, and employers as well feel certain about what they are required to do.
In fact, on that subject, we've had a tweet in from Laura Howard. If and when the schools return, so obviously teachers, their employees as well, will school staff and pupils be expected to wear PPE? Nick is referring to PPE. Afua.
I again think that this is where trust comes in. And if we were in a position where the government had been honest with us and taken all of these concerns seriously from the beginning, I think it would be a lot easier to listen to the proposed guidelines about returning to work. But I've seen unions, workers' groups already voicing quite extreme concern about whether they will be protected when they return to work. And amidst this, we have the spectre of the people who are working on the front line not being adequately protected. So there is a real sense that people's lives are being put unnecessarily at risk. And I'm as keen as everyone else to be able to get back to some semblance of normality, for my daughter to return to school. But on the other hand, I think that we do need those assurances that we will be kept safe. And I think that they need to be crystal clear, as Jürgen said. That's a really important phrase. But also they need to be binding. Otherwise, if they're optional, we know there are employers who will flout good practice. And we know that we don't have a perfect record of safety at work. So this is a time for those standards to be increased and heightened and made crystal clear and not to be optional.
In fact, we've had another comment in from John Beattie. Should workplace guidance on coronavirus protections be legally binding or optional extras?
I think we just need to be careful about making the assumption that it's all on the guidelines. So can I just share with you my dilemma as the chief executive of an organisation? We're not a very big organisation, we've only got 60 staff, but our office is really quite difficult because we've got a very narrow corridor which effectively enables people to get to and from their desk. And there's no way that we're going to be able to observe social distancing.
Or have a one-way system or anything.
Yeah. So you can have all the guidelines that you like, but what actually you also need is you need leaders of organisations who think that the welfare of their staff is by far the most important thing. And certainly that's what the way that we act as our senior leadership team in our organisation. But also you need the ingenuity of staff to help you do things like work out how would you create a one-way system if you've got a narrow corridor.
These things, I mean, because obviously you're talking about the people in your office, but when it comes to ambulance workers, community trust workers, hospital workers, who you're obviously here, as the face of that, do you think that these protections for workers should be legally binding, as is being suggested, or optional extras, as John Beattie is suggesting?
I don't think they should be optional extras. I think we should absolutely ensure that leaders are held to appropriate account for creating safe workplaces. But to be frank, that's what the existing health and safety legislation does. And
so that is legally binding.
Yeah, that is legally binding. So. And what we also know is that life is now becoming really complex. So I was talking to a hospital chief exec the other day who's literally had to divide their hospital into a COVID zone and to a non-COVID zone, and that's actually created some really complicated issues. Classic example is we're all saying, quite rightly, let's restart all the elective surgery, for example, but that particular hospital is going to lose quite a lot of its capacity because effectively it has to divide that hospital into a safe non-COVID zone and a COVID zone. So there are lots of complexities, particularly for those people who work in health and care settings, to ensure that they are providing a safe environment for their staff.
So George, when you hear someone like Charles who says he's apprehensive about returning to work, hot desking is going on, colleagues are less than 2 metres away, as far as you're concerned, should someone like Charles be able to say, without fear of being laid off, it's not safe enough, it's not adhering to best practice, I'm not going to come in?
Well, it's why the government's been doing a lot of work on this over the last 2 weeks. We've been working with employers, we've been working with unions, because we want people to feel reassured and able to return to work. And it's important to note that there are sectors of the economy that never shut down. So the food industry, for which I'm responsible for, if people go to a supermarket, they will see all sorts of social distancing measures that have been put in place, but also food manufacturers, everything from bread factories to meat processors, dairies and so on. They have all managed to put in place social distancing measures. And when I talk to those businesses, their level of absence for people self-isolating due to the coronavirus has fallen from a peak of about 20% at the very beginning of this episode about 5 weeks ago, down to about between 3 and 6%, which is actually quite close to normal levels. So the measures they've put in place have been successful.
Coming to Charles's question, though, can you outline what precautions the government are proposing to ensure safety at work? How can you make someone like Charles feel safe? And are you going to make it legally binding, as the TUC was suggesting you should, or is it just going to be something that you expect companies to go along with?
Well, look, there are... the difficulty of being too prescriptive is that different businesses will have different approaches. And so, for instance, in the retail sector, we discovered that a small convenience store might have a very different approach to a large supermarket, and the practicalities of doing things are different. A large supermarket, for instance, might restrict cars going in at the entrance. A small corner shop obviously will take a different approach. And so you need to have enough flexibility for employers to be able to do what works in their environment. I think in the office environment that he cited, where there's hot desking, I think the reality is that there will still be a strong encouragement of businesses that are office-based to enable people still to work from home as far as possible, so that actually you don't have high densities of people crowded into those office environments using shared equipment.
See, my issue here is I feel that we need a bit of reality, and there will be lots of responsible employers, there already are, who are doing the kinds of thinking that you're doing and taking the right steps and really investing and caring about protecting their workforce. But there will always be employees who aren't responsible and are willing to put their workers at risk. And these conversations are designed to protect people who work for the worst case scenario business. And that's why we need stringent measures that are not optional, because otherwise people who are vulnerable, who are too insecure to be able to challenge safety at work, or too dependent on 0 hours or other insecure contracts to opt out of working, won't be protected. So we've got to be thinking about the worst case scenario, not the best case scenario.
So what are your thoughts? I mean, I presume that's something the government is looking at.
That's not our experience dealing with a food business that's got large companies and small companies.
All companies.
Look, everybody takes this very, very seriously. Employers take their duty of care to their employees very, very seriously.
But hang on a minute. The reason the Health
and
and Safety Executive exists is because there are companies that don't take it seriously enough. Are you suggesting that sort of miraculously they all suddenly will now?
No.
Or what are you proposing
all of them
to put in place?
in these circumstances. So the Health and Safety Executive have been involved with some of the guidance with food companies, as has Public Health England, have indeed as the Food Standards Agency as well. All of those agencies have been working and contributing to the guidance that businesses are following.
But are you anticipating
I think
that...
the point
OK,
here-
Jürgen, sorry.
Yeah, I think the point here is, Fiona, there is an existing process. You know, every director of a company, so every employer in the country knows their responsibility towards keeping their employees safe. You know, it is crystal clear, and you have to do that, you know, any time, not just in this COVID time. We're now adding COVID, living with COVID, working with COVID as a requirement to keep safe. We get some guidelines around that. I totally agree with Afua. Most employers will do that because they take it seriously. If, quite frankly, they don't, they shouldn't be in business. Safety comes number one. And the Health and Safety Executives will enforce the few that don't. And it is the few. It isn't the many, in my experience.
George, do you think, from where you're sitting in government, do you think it's going to be difficult to get people back to work? Obviously, people are desperate to start earning again and all of that, but they're anxious too.
There will be some apprehension, of course, and that's why we've been working on this guidance. But I come back to my experience in the food sector, where they had high absentee levels of about 20% at the beginning. And it is right now down to about 4 or 5%, which isn't much different to normal. So what people discovered is that once those social distancing measures were put in place, staff returned to work. Some of them returned from being in isolation. Some of them returned because perhaps they were anxious, but learnt that actually these measures have been put in place and it reassured them.
But we're all going to have different complications, aren't we? So a good example for us is we work in the centre of London, and when we've been talking to our staff about beginning to think about what might happen, quite rightly, one of the things they immediately raise is, well, what's it going to be like trying to travel into work into central London and actually being on a packed tube train next to people who might present a safety risk. So I think one of the issues I think the government faces is this is quite multifaceted. You know, it's not only, George talks about the food industry because he's responsible for that, but we also need to ensure that, transport is appropriately configured. So this is quite a complex picture if we're actually going to be able to encourage people and enable and support them to kind of come back to work.
Because we have the example of other countries who are ahead of us.
Yeah,
that we can follow,
which is helpful. We can learn from that.
Well, I have to say, our hour is up. We've had lots to talk about. There were more questions. I'm sorry I didn't get round them. Thank you very much. Margaret and James have sat in and asked your questions at the beginning, and you sat through and listened to this. So thank you very much for your patience and for your questions at the very beginning of the programme. And we're hoping to get more of you at home to take part in the programme live. If you think you'd be up for that, let us know. Otherwise, of course, you can pre-record your question, but I'm keen to get as much of that in as I can. So do let us know in the usual way at the Question Time website. And, of course, if you want to carry on the discussion that we've been having this evening, you want to ask more questions, put more of your comments across, you can join Adrian, Charles and guests on Question Time Extra Time, and that is on 5 Live now. But for now, thank you very much, as I say, to Margaret and James, to Nick and Jürgen for joining us down the line. We've got a little peek inside your homes, not enough for my liking. I'd like to see a bit more. But thank you very much to all of you. And, of course, to George and Chris and Afua for joining me here in the studio, and for you for feeding in your questions and comments, and, of course, for watching from Question Time. Bye-bye.
so?
I hear you've been very naughty.